Have you ever wondered what actually happens during a glaucoma screening appointment? Many patients feel nervous or unsure about what to expect. The good news is that most glaucoma exams are painless, highly informative, and designed to protect your vision. Let's walk through what typically happens during a glaucoma screening appointment. I'm Dr. Constance Okeke, your host. Let's talk about what happens during a glaucoma screening appointment. Diagnosing glaucoma requires a comprehensive eye examination performed by an eye care professional. There is no single test that confirms glaucoma. Instead, your doctor combines information from several tests to understand your eye health and determine your risk. Let's walk through some of those most common parts of a glaucoma screening exam. First, your doctor will check your vision. This is called a visual acuity test. You'll read letters or shapes on a chart to measure how clearly each eye sees. This helps establish how well your eyes are functioning overall. Next, your doctor will examine your eyes using a microscope called a slit lamp. This special instrument allows your doctor to carefully evaluate the front and inside structures of the eye, including the optic nerve, the part of the eye that glaucoma damages. Another important step is measuring your eye pressure, also called intraocular pressure or IOP. This test is known as tonometry. Numbing drops are placed in your eyes and a small instrument gently measures pressure at the surface of the eye. There are several ways to measure eye pressure, and the process is usually quick and comfortable. Your doctor may also perform a test called gonioscopy. This test helps evaluate the eye's natural drainage system, known as the angle. Understanding whether the drainage angle is open or narrow helps determine the type of glaucoma you may have and guides treatment decisions. Next, many patients undergo a visual field test. This test measures your side or peripheral vision. Glaucoma often affects the side vision first, sometimes before patients notice any symptoms. Visual field tests help us detect and monitor vision changes over time. Imaging tests are also commonly used, especially optical coherence tomography, or OCT. This advanced scan measures the thickness of the optic nerve fibers and helps detect early damage. OCT allows doctors to compare results over time and track whether glaucoma is stable or progressing. Your doctor may also take photographs of your optic nerve. These photos serve as a baseline reference, allowing comparison with future exams to detect subtle changes that could indicate disease progression. Together, these tests provide a detailed picture of your eye health and help your doctor determine whether glaucoma is present, whether you are at risk, or whether your condition is stable. Establishing these baseline measurements is one of the most important steps in protecting your vision. Glaucoma is often monitored over time, so these tests allow your doctor to detect even small changes early. In our next video in the Glaucoma Patient Journey series, we'll cover how often should I be screened for glaucoma, and is there a simple test I can do at home.